on to our next speaker today, and it's actually a panel. So I'm going to introduce my colleague, Brad Tufto, who's the retail specialist, an FDA retail specialist as well. He's stationed in Spokane, Washington, and he is the specialist for the states of both Idaho and Montana. Prior to coming to FDA, Brad worked for about 20 years at both city and state health departments throughout the United States. Brad, I'm going to turn it over to you. Thank you.
Thank you, David. Can you hear me all right?
Yes.
All right, wonderful. Hey, again, congratulations to those that were recognized for their program standards achievement. Great milestones during a very challenging time. I'm here to talk about today is the food freedom and or cottage food bills that had a pretty consistent presence in state legislative debates over the last few years. So here today are three panelists who will share their experiences in dealing with the passage of food freedom bills. Each panelist is going to have about 10 minutes to present their information, and then we'll take some questions at the end if we have time. So please put your questions into the chat, and if you would please identify the panelists who you'd like your question directed to, that would be helpful. With that, let me introduce our panelists. First up is Ed Evanson. Mr. Evanson has been with the Montana Department of Health and Human Services, Food and Consumer Safety section for the last 10 years. The last 5, he's been program supervisor. Our second panelist is Julie Wagendorf. Ms. Wagendorf is the Director of Food and Lodging with the North Dakota Department of Health. She's been with the department for over 18 years. And last, we have Justin Daniel. Mr. Daniel has worked at the Lincoln Lancaster County Health Department for 21 years. He has 16 years of field experience and currently supervises staff of 8 field staff. I do invite you, as David mentioned earlier, to take the opportunity to review their full bios and the bios of the other speakers you're going to hear today on the Pacific Retail Breakout page. With that, Ed, I'd like to turn it over to you.
Brad, can you just confirm that you can hear me?
Yeah, I hear you, Ed.
Okay, great. Can you transition to the next slide? Perfect. Okay, so before I jump into this, I just want to give a little bit of background on food freedom and cottage food in the state of Montana. So for the last 20 or so years, the state of Montana has had a cottage food law in place. And that allowed for people to produce certain non-potentially hazardous foods in their home kitchens and sell those at a limited market, specifically farmers markets. So farmers markets around the state were allowed to host folks who produce things like jams and jellies, cookies, cakes, certain pies, things like that. And then about, I'd say 10 years ago, there was an initiative to broaden the scope of Montana's cottage food laws. And there became, the process that they used included members of industry, members of government, and members of academia. And they went around the state, had listening sessions, and about 6 years ago, the Montana Cottage Food Law was passed, and that law broadened a little bit what was allowed to be sold under cottage food, and then also expanded the marketplace. So you could sell anywhere direct to consumer So the producer could produce cookies, cakes, things like that, non-potentially hazardous products, and sell those direct to consumer. No retail, like retail establishment sales were allowed, things like that were still prohibited. But it allowed for sort of marginal or I guess a small amount of oversight by regulatory agencies, and then expanded their marketplace. So then, so that has been in place for the last 6 or so years. And then during this last legislative session, Senate Bill 199 was passed. And this is also known as the Montana Local Food Choice Act. And this eliminated all of the restrictions within cottage food. So folks could produce just about anything in their home kitchens now in Montana with the passage of this bill, and sell those products direct to consumer. So that's kind of the background, and then I'll jump in to a little bit more of the details. So if you could move on to the next slide. So this is just a big picture overview. Like I said, just about any homemade food is allowed. The other thing that they threw in there was raw milk. So the sale of raw milk was prohibited in Montana, and that's no longer the case. So we kind of a 1-2 punch for us. We have legalized raw milk sales and homemade foods that have now expanded beyond the realm of just non-potentially hazardous. The other kind of wrinkle in this is that beyond just selling to what the bill calls an informed end consumer, they can also sell these products at traditional social community events. So this is farmers markets, potlucks, bake sales, church gatherings. There's a list of about 10 to 15 things in the bill. Next slide. So I'm not going to read all of these to you, but I do want to focus in, and I have another slide on this later, on a couple of things. So the bill made an effort, at least, to limit it to sales between the producer and an informed end consumer, and then limited the locations for consumption to the home, but then also kind of broadened that and created a bit of a gray area with these traditional community events. And then there is supposed to be some information provided by the producer. Unfortunately, the bill doesn't provide a lot of details as to what that means, which leaves us in a tough position if we're trying to track things down later. And then the one thing that's not allowed are meat products. So, which is a significant limitation, but I'll get a little bit more into that later. If you could transition to the next slide. So raw milk, like I said, raw milk's allowed under SB 199, again, sold directly to an end consumer or at a traditional community event, and it cannot be donated. So that's a really big change for Montana, and something we're sort of struggling to transition to and grapple with how to sort of manage that. Next slide. So again, the bill was a bit gray in a lot of areas, so there was some concern. So this last legislative session, Montana was also, we had medical marijuana, which is legalized, and now recreational is legalized. So the question came up about whether or not drugs, alcohol, products like CBD could be allowed under this law. Our current legal interpretation from our department is that no, that while these are not expressly prohibited within the bill, it does imply that they're restricted, and we do have more restrictive laws that prohibit the use of these products. Next slide. So this is one where, you know, you talk to non-sanitarians and they just laugh. They're like, well, you have to define meat. Well, yes, we do. Unfortunately, the bill does not define meat, which has left it open to a bit of interpretation. Our Department of Livestock does have a fairly broad definition, broader, I'm told, than many other states. So we've kind of deferred to them, and if they call it meat, then we're calling it meat. And we have been coordinating closely with them to make sure we're all on the same page. And they've been super good to work with, and that there is a link to a guidance document that we've put together with them to kind of help clarify what meat is. Next slide. So little things that this has changed for us. The first thing we did was change our 72-hour food history questionnaire. So raw milk consumption, asking what that is. And then also asking if people have consumed food that was purchased, and I forget how we phrase it exactly, but essentially food that was produced in a home kitchen that they purchased. And we're gonna, you know, as part of that, we're gonna track illnesses associated with these products, and kind of attempt to collect and share stories as we, you know, hopefully there are no illnesses, but with some of these products, we're already starting to see some illnesses that we've linked back. So trying to kind of get the stories there so we can share those at future legislative sessions. Next slide. So I mentioned illnesses. So this bill has been in effect. It had an immediate effective date, and I think our legislative session ended in March, I want to say, and we've had 3 confirmed illnesses that we've traced back to raw milk via our you know, new updated 72-hour food history. So 2 crypto cases and 1 Campy case. These were all associated with raw milk. So we haven't had any that we know of yet associated with homemade food products. Like I said, we're keeping a close eye on that. Yeah, continue to keep an eye on the raw milk side of things. If you are in a situation where you're trying to track down somebody to test a milk sample for crypto, feel free to give me a call. We spent about 2 weeks trying to figure that one out. And it's trickier than I thought it would be, but happy to chat about that with anybody who's in that same unfortunate situation of needing to sample raw milk for crypto. And that, I think, is all I have for today, and I can open it up to, I know there's 4 or 5 more folks, but I'm going to stick around and happy to answer questions either now or at the end of the panel.
Thank you, Ed. And I know you're on leave this week. I want to say I appreciate your willingness to give us some of your time. And with that, we're going to do questions at the end. With that, let's transition to the next slide, and Julie Wagendorf.
Yes, hello, and good afternoon. I'll be giving a brief review of the past 4-year history of North Dakota's cottage food law. North Dakota's 2017 legislative session House Bill 1433 was introduced regarding direct producer to consumer sales of cottage food products. The bill that was introduced was modeled almost verbatim after Wyoming's Food Freedom Act and originally included the sale of raw milk and raw milk products, as well as unregulated sale of any food and drink produced in a cottage food operator's home. There were exceptions for meat and some limitations on poultry based on the size of flock. By the end of the 2017 session, however, there were some key differences in North Dakota as the bill went through several amendments. Raw milk and raw milk products, for one, were removed from the bill. And so raw milk sales in North Dakota remain prohibited unless purchased as part of a cow share. Also, through an amendment, a definition was added for a cottage food product, replacing the bill's original phrasing of any food and drink. So our Century Code defines a cottage food product as baked goods, jams, jellies, and other food and drink products produced by a cottage food operator. The Health Department received many questions from cottage food operators asking for clarification. And our stance was that clarity is needed for what other food and drink products means within the definition of cottage foods. As we know, anything not authorized under the cottage food law falls under regulation and requires a license and inspection. So often the question comes to us as to what requires a license and what does not. Temporary food establishments and catering operations are most often questioned in our state. And then during the 2019 legislative session, which was the next session, we also had another bill proposed and introduced by state legislators. And that bill proposed details in law which prohibited food products. And we thoroughly discussed and comprehensively vetted through numerous legislative committee hearings, despite what several viewed as a reasonable compromise. 2/3 majority of the House didn't agree, and the bill was killed on the floor, primarily due to our exclusion of low acid home canned foods as a cottage food product. And so we are left to going back to square one. Next slide, please. Next, I'll share some of North Dakota's experiences with legislative intent, interpretation, the legislative process, and a few tips on how to navigate it all. So once a bill is introduced, your agency may or may not be made aware beforehand. You may find out once it's introduced during session and placed on the schedule for a hearing. Ideally, or in an ideal situation, you'll be consulted and asked to help draft these bills ahead of time. What might help with that is developing relationships with farmers markets associations, the food freedom associations, oftentimes conservative groups or ultra-conservative groups and political caucuses that support food freedom. Follow social media. Those food freedom groups are often loud and are not too difficult to find on Facebook or other social media platforms. Then once the bill is introduced, it's assigned to a committee. I would recommend that you review who's on that committee and anticipate what information can be provided by your agency or other subject matter experts that would be most influential. Be familiar with your agency's procedures for tracking bills and who the main point of contact with your agency is with legislators, and also make use of the tools available to stay informed on dates, times of hearings, and committee work. This might be electronic tracking apps or posted schedules. If you're not familiar, I recommend becoming familiar as soon as possible or ahead of time if possible. Then with testimony, you're going to determine if you will testify on behalf of your agency for, against, or take a neutral stance. And also, again, you need to be familiar with your agency's approval process for drafting and getting testimony approved and published for open record. If you need help, you can always ask colleagues. Those of us on this call and this panel, I'm sure we've all drafted our share of testimony. I'm happy to share at any time. And then also, I was just going to mention that for testimony, you may want to try to avoid lengthy testimony and lecturing. Sometimes is not well received by legislators. What would be better is to line up constituents such as small business owners, licensed bakeries, retailers who might struggle from a competition without fair standards, consumers or advocacy groups, such as those interested in allergen prevention, and victims of foodborne illness who can tell their story. Local public health units, your local partners, state and regional environmental health associations, academia, extension services, those are also great resources and bring value to informing legislators during session. So when bills are amended or marked up, legislators consult lawyers to draft language. And the attorney-client privilege is confidential, and you most likely will not see a draft of those amendments until it's scheduled in hearing and introduced for the record. What you'll need to do is receive permission from the legislator drafting the amendments to see a draft beforehand. Some tips on how to get that accomplished. Outside of developing relationships with legislators, after the committee hearing, there's committee work meetings that are scheduled. These are also open to the public, and although they don't take on typically additional testimony, it's still important to attend, especially if you have those relationships built, because the chairperson or a committee member can call on you to help answer questions, set the record straight, or gather additional information for the committee to consider. And then also, a lot of times when amendments to bills are worked on, they're worked on during these work sessions before the next hearing is scheduled. So once the majority of vote is offered within committee, the committee takes their recommendation to the floor. On the floor, the legislators can and will take this time to have additional floor debate and discussion to influence votes. That also happened in North Dakota, and the floor vote did end up going against the recommendation of the committee, which resulted in the bill in 2019 being killed. Next slide, please. Also, to prepare, you may anticipate questions or concerns that you may get asked to comment on. And just under these broad categories, under economic, you have allowing the production and sale of cottage foods is often viewed to promote economic growth for local businesses and communities. This provides new opportunities for small startup businesses and home-based operations, often owned and operated by women. The cottage food laws allow for the purchase and consumption of locally grown agricultural commodities. And so in designated areas, or areas designated as food deserts, would regulation limit these important food sources? Also, consider that prohibiting low acid canned foods limits opportunities for growers to market items past the growing season. So their main concern is that it's viewed as a loss in revenue. We did try to compromise in, providing frozen vegetables as opposed to low acid home canned vegetables. But needless to say, that was strongly opposed by the food freedom supporters. Under regulatory, take the opportunity, if you can, to explain what is required by your agency. They honestly may not truly understand what it is your agency does for the state. And so take the opportunity to explain what your obligation is under statutory mandates, that you're required to do licensing and inspections if it's not clear. That makes it difficult for you both at the state or local level. in issuing licenses, and also the unintended consequences would be that different local or state staff may interpret the law differently, and this would result in a lack of uniformity and potential enforcement actions, causing even more confusion for the operators. For interstate commerce, we do have a clause in our law that prohibits interstate commerce or internet sales. And then under safety, you know, in this audience, you obviously know the risks and the concerns that we have with opening these laws to be so unrestrictive with some of the risky processing methods or higher risk processing methods. The supporters of food freedom used the reasoning that nationwide outbreaks happen, and therefore local food and homemade food is more safe for consumers. And that was their strong belief. We received many questions about how many foodborne outbreaks have been caused by cottage food since it became law, and how many complaints of illness. So you may want to be prepared to explain underreporting, sporadic disease reports, and cluster investigations that may not be published as outbreaks, and the costs associated with hospitalizations and loss of productivity, even for small outbreaks and clusters. Next slide, please. So in closing, when telling your story, begin with the end in mind. Who do we protect? For me, that's also the why. How we protect through education, inspection, and accountability. And you may take the opportunity to ask yourself within your regulatory jurisdiction, how easy is it to get licensed? For instance, using a shared kitchen. This may also help decrease startup costs. And could you use some resources in targeting messaging and outreach for starting food businesses? In the license application process, I felt that we found out a lot of cottage food operators in our state were surprised at how easy it actually is to come to our office and get a license. So that's something we've been trying to do more of. And finally, what is the end goal? At the heart of every vibrant community are businesses and special events that keep the local economy thriving. Some practical goals are maybe to provide new opportunities for small startup businesses and home-based operations that support locally grown agricultural commodities, to instill practical science-based food safety guidance, and to continue working together on a solution that builds and adds value to our state's integrated food system while preserving public health and safety for consumers. And that concludes my session.
Thank you, Julie. I have received a couple questions, so if you can hang on for the end, we'll answer questions at the end then. Next,
Okay.
I'd like to pass it over to Justin. Julie and Ed have given us some information from the state perspective. Justin is going to give us that perspective from the local level. Go ahead, Justin.
Yes, thank you, Brad, and thank you to the Pacific region for the opportunity to present. Nebraska is still relatively new with the cottage foods, and even at the local level, relatively new. But my name is Justin Daniel. I supervise the food safety program here at the Lincoln-Lancaster County Health Department in Lincoln, Nebraska. And as Brad mentioned, I supervise 10 total staff, and 8 of those staff are the field staff. Next slide, please. So when I said we're relatively new, LB 304, or Legislative Bill 304, was passed in April 2019. This is also known as the Cottage Food Law. But what this did was amended the Nebraska Pure Food Act which allows for sales other than a farmer's market, but allows for a person to prepare and sell food from home, given that that food is not a time temperature control for safety food. And this law does specify that the sales does need to be directly to the consumer at a public event for pickup or for delivery. The cottage food operator cannot wholesale their product. It has to be directly to the customer. So next slide, please. So when the state adopted LB 304, we of course on the local level, we have a city food code, and our city food code still prohibited food to be produced in the home kitchen. So after the passage of LB 304, our department worked closely with stakeholders to discuss on how to best incorporate LB 304 into our local food code. So in consulting with our stakeholders, those included, we have a food advisory committee, and that committee provides guidance to our department on the effective regulation in regulating food in a means to best protect the public health. We reached out to our farmers markets, our managers, and our market vendors that we have record of, understanding that a lot of the market vendors will probably be interested in also participating in this cottage food law for sales from the home. We have a board of health. We do conduct public meetings when we're looking at changing our local food code. And lastly, anytime we do make changes to our code, we work closely with our city attorney's office for legal counsel to make sure we're following things in the proper manner. So after discussions with our stakeholders, the decision was made to adopt most of the requirements into our local food code that are based on the AFTO's regulatory guidance for best practices on cottage foods. Next slide, please. So some of those requirements in the AFTO's guidance that we incorporated into our local food code, and also to be consistent, I should have mentioned earlier with LB 304, cottage food operators are required to register on our Nebraska Department of Agriculture's website. They just register their business with the Nebraska Department of Agriculture. So locally, we incorporated into our code that in the city of Lincoln, where our food code applies, the cottage food operator must apply for a registration with the Lincoln-Lancaster County Health Department. We do charge a fee for that registration. And upon receipt of registration, the health department staff and myself, we provide a consultative visit with the cottage food operator. And the purpose of this visit is to convey information related to the safe production of cottage foods. And during that consultative visit, we verify, we do have requirements we verify that the requirements are being met, which includes the completion of an approved cottage food or food handler training course. The University of Nebraska Extension developed a cottage food law training course. And also we, on the local level, require food handler training. So we do want the cottage food operator to successfully complete, to gain basic knowledge on a cottage food operation. If the cottage food operation has a private well, We do require that water supply be tested initially for nitrates and bacteria, and then on an annual basis after that. Okay. Other aspects that we feel the need for this consultative visit, so we can have communication with the cottage food operator that just to clarify that only non-time temperature control for safety foods are produced and sold. This has come in handy. Some of the registrations that I've received do have foods that would not be approved or not meet this definition of a non-TCS foods. We verify that ingredients used in preparation for cottage foods are held at safe temperatures. Primarily, these are eggs that are used in the preparation of cookies or brownies or cakes, and just so their home refrigerator is maintaining safe temperatures. Norovirus, in an effort to reduce the chances of norovirus or any fecal oral contaminant, we do have a conversation that no children who are not toilet trained in the home are in the home kitchen during the preparation of cottage foods. And likewise, if the cottage food operator has pets, such as an indoor cat or dog, we do require that the pets or no pets are allowed in the kitchen during the preparations of cottage foods. These are just some basic common sense practices that we feel are essential to protect the public's health. Next slide, please. This is a continuation of what this consultative visit consists of. We talk about, so the cottage food operator has the ability to properly wash, rinse, and sanitize their equipment. Most of the cottage food operators I've done a visit with, they have a dishwasher with a sanitizing cycle, and just to verify that that's working. If they don't have a dishwasher, I'll talk about setting up a sanitizing solution so they can still wash, rinse, and sanitize. Just an overall assessment of the food preparation areas, so that sanitary conditions and there's no evidence of pests. And the next two are, once again, to minimize the potential of norovirus. As we know, norovirus after the food is prepared can still be a contaminant of the product. So we go over that the cottage food operator does not prepare food if they are experiencing symptoms of vomiting or diarrhea. If we discuss if they are sick, take care of themselves, get feeling better before they resume their cottage food operation business. And we ask that they're symptom-free for 48 hours. No bare hand contact is allowed with the finished product or with ready-to-eat foods. So primarily when the foods are being packaged, commonly what the operators have are gloves to package their products. Some will have utensils of some sort, so they are not touching the food with their bare hand. And lastly, we discuss labeling requirements for the cottage food product. So just so the consumer is well informed that the product that they are purchasing was made by a cottage food operation. So we feel that these safeguards are essential in ensuring that the cottage food products being sold directly to the customer are safe and minimize the risk for a safe product to the public. So with that concludes my presentation.
Thank you, Justin. Julie, if you could join us back on camera, I do have a series of questions that have come in. The first question is for Ed Evanson. Are there standards for raw milk in Montana?
So, I mean, I would say no. They have to be tested once every 6 months, I think is what SB 199 says. So I guess you could technically say that there are some standards based on that testing, but pretty minimal.
Or at least a new requirement 199 created. Okay, thank you for that. Question for Julie. Can you share any successes and challenges you had with home kitchens?
Successes and challenges, can you repeat that?
Yeah, can you share successes and challenges you've had with home kitchens?
Well, to be honest with you, we don't have any requirements in North Dakota to register, license, or inspect the home kitchens. And so we don't actually go on site to work with any of the home kitchens on site. And so the challenges that we've run into so far have just been a lot of questions on interpretation of the law and what is and isn't allowed as a cottage food. That's kind of where we're at.
Okay, thanks. I'd ask you the same question, Justin, but I think you pretty much covered it in your presentation already. So Julie, another question for you. Washington State has had micro enterprise kitchens proposed the last few years, and it seems to be gaining popularity on the basis of equity and opportunity. How would you recommend public health approach these topics that can have a huge impact on the food safety programs, especially in light of the growing interest and popularity of many of these bills? That's a mouthful.
Yeah, I think I can have that. Just to paraphrase it. So micro enterprise. I'm imagining those are in a home-based kitchen and available for retail and wholesale. Is there?
I don't have any information in the question to break it out further.
So, I mean, just kind of based on assuming we haven't really had a lot of activity in North Dakota for those types of establishments. We also, tried a number of different avenues when working through our legislation, and that included considering could there be a license, a registration and inspection process for the cottage food industry or micro enterprise industry, home-based bakeries, on what other types of similar businesses. And in our state, there was no desire to have any government oversight at all. So the sponsors of the bills were not really interested in our state to include that as kind of part of the package. They just really wanted absolutely no oversight, no inspection, no regulation, and that's how it was proposed to us that session.
Okay, thank you. Couple questions here I'm going to direct to Justin. Justin, do you allow any folks from outside of Nebraska to attend any of your training?
Those trainings are web-based, so yeah, anyone could log in and pay the fees and get that knowledge.
Okay, great, thank you. And there was a question that was associated with that. Do you partner with a cooperative extension or outreach or educational workshops? So, yeah, go ahead.
When the when the cottage food law training was being developed, the University Extension did reach out to not only me, but they reached out to the Nebraska Department of Agriculture and also Douglas County Health Department, which is another local, which has Omaha, Nebraska in it. Just to work in collaboration and making sure we're all reviewing that cottage food law training, so we're all on the same page.
Okay, thank you.
And we are fortunate locally. We have the University of Nebraska that has a robust food sciences curriculum that if there are any food products that are questionable, we'll send them to UNL so they can test or go through their process to verify that the food is safe or would be a non-TCS product.
Okay, thank you. I think we have time for one more question. I would like each of you to answer this, and let's just go in the order that you presented. Do either North Dakota, Montana, or Nebraska have any evidence of foodborne outbreaks from a cottage food operation? Ed, do you want to start out with that one?
Sure. So I would preface my answer by just saying up until 6 months ago, all of our cottage food operations were limited to non-potentially hazardous foods. So cookies, cakes, things like that, jams and jellies. Since the Montana Local Food Choice Act passed, we don't have any documented outbreaks from home-produced foods. Although our definition of home-produced foods is probably a little different than other folks because it does include raw milk. So if you include raw milk in there, we have those 3 that I mentioned in my presentation. But if you're thinking more specifically about the food products that are being outside of milk, the food products that are being produced, we haven't yet tied any illnesses or outbreaks back to any of those products.
Okay, thank you, Ed. Julie, do you have anything for North Dakota?
Since the law was enacted in 2017, we haven't linked back any foodborne outbreaks to cottage foods sold in our state. Prior to that, there's been home catering situations of unlicensed caterers where we have had a large salmonella outbreak, but that predated the cottage food law. So nothing since 2017 that we have on record.
Okay, thank you. And Justin, lastly with you.
And I would also say, this went into effect in April of 2019, and I'm not aware of an illness outbreak related to the cottage food product.
Okay, thank you very much. Thanks to all the speakers and presenters here on this panel. Great information. I hope all the states and locals that are attending today were able to pick up some tidbits. And again, remember their contact information and bios can be picked up on the breakout page. Thank you again.